Next is the elbow exam. We'll start with maneuvers to identify lateral epicondylitis. This is done by taking the patient's forearm and extending the wrist, placing the thumb over the lateral epicondyle, and having the patient extend the wrist while the examiner resists. A positive sign would be tenderness over the lateral epicondyle. The next test is for medial epicondylitis. This is done by placing the thumb or index finger over the medial epicondyle, having the patient flex the wrist, and the examiner resisting that wrist flexion. Once again, a positive sign would be reproduction of pain along the medial epicondyle. The next group of tests assesses for cubital tunnel syndrome. Tinel's at the cubital tunnel. This is performed by placing the ring or the index finger over the cubital tunnel and tapping 4 to 5 times. A positive test would be indicated by reproduction of ulnar nerve symptoms in the ring finger and the 5th digit. The next test is the pressure provocation test. The examiner places his or her index and ring finger over the patient's ulnar nerve, proximal to the cubital tunnel, with the elbow in flexion and the forearm supinated. The test is held for up to 60 seconds. A positive test is reproduction of ulnar symptoms, numbness in the 4th and 5th digits, or concordant pain. The next examination is for radial tunnel syndrome. This is done by palpating the proximal forearm over the arcade of Frosch. A positive test would be indicative of tenderness over this area. You would also assess for middle finger liftoff, and you would check for paresthesiae. The final elbow exam is for pronator syndrome. This test is done by starting the patient in a supinated position, taking the patient's hand, and having the patient resist this motion while extending the arm. Palpation over the pronator teres, if positive, will cause tenderness.